All right. Well, chapter 1 looks at everything. It kind of gives you a nice little primer for why do we want to look at nutrition? Why do we want to study nutrition aside from we need it for prereq? It's a required course. We'll break down some of the nutrients here, and then we're going to expound upon these, especially within the second unit when we start looking at the macros. And then in the third unit, it looks at the micros, vitamins, minerals, water, even though that's not necessarily a micronutrient. Third looks at kind of obesity and the other component of healthy lifestyle besides a healthy diet, exercise. We'll look a little bit of some eating disorders. And then in the last unit, we apply what we've learned about the entire semester to specific times in your life. Obviously, like I mentioned earlier, nutrition changes quite a bit from 0 to 2, hell, 0 to 1, hell, 0 to 6 months. Nutrition is a heck of a lot different than it is year 2. Nutrition is very different in toddlers, school age, adolescents, adults. So in that last unit, we take these concepts that we've been talking and learning about all semester long and apply it to those specific times in your life. So we are looking at nutrition from the beginning to the very end of your life. Okay? At the beginning of each little kind of section within each chapter here, I have some learning outcomes, some questions. If you can answer these questions, okay, if you can answer the questions at the back of each chapter, you're going to do pretty decent on these exams. Okay? I usually hint at what my essay questions are going to be. Okay, so hopefully you're listening or watch it back on a replay at another time. I may give you 5 or 6 or 7 different great essay type of questions, and I'm not going to ask every single one of them. I only ask roughly 3 or 4. It just depends on the unit. Okay. Food is the basic things that we need. If you have a nice, healthy, nutritious diet, it will allow you to focus better, perform better in school, feel better about yourself, and ultimately not develop these chronic diseases. Okay? And a lot of nutritional studies coming out show a lot of this stuff is hardwired and set up in those first few formative months of life. We're finding now that it's mom and dad. I mean, it's mom's fault, right? It's always mom's fault, right? But what mom does pre-conception has a lot to do in setting you up for success or failure, depending upon how you want to look at it, to how you are going to be health-wise 20, 30, 40 years down the road. It is quite crazy, some of that. A lot of great studies have been coming out recently over the past maybe 10 years or so, looking at that preconception nutrition of what mom does and how that affects the child growing up. What is in this food? What is in this beautiful, healthy food that we're going to be talking about? Nutrients. Okay. Nutrients are going to be these substances that are necessary for growth and maintenance. If you don't get enough protein in those first several months of life, you don't grow at the proper pace. And if you have a total lack of protein specifically, then ultimately that can develop into marasmus and Koshwash-Core. Those are severe malnutrient type of conditions that we don't necessarily see here in the States. We don't have a huge deficit in food availability, right? But in third world countries where they don't get enough, that can really affect growth of these tiny little kids. We can have that here in the States. That's neglect generally. Failure to thrive is where you would see that type of thing, where you'd have a failure of growth occurring at the proper pace. But to maintain yourself and just sit there and be a bump on a log takes a bunch of different nutrients, a bunch of different things. And we'll be talking about that. Nutrition is the scientific study that looks at how your body utilizes these nutrients, how they interact with one another. Okay? And that's sometimes the hard part. That's why nutrition is so difficult, especially in the elderly. The average elderly individual, 65 and older, takes 13 different medications. 13 different medications. That's average. So, some are taking like 5 and then some are taking like 35. Holy smokes. What do those medications do inside the individual? They all interact with one another and they change things, but that also affects your body and how they utilize nutrients. So that's why nutrition during specific life cycles can be really tricky, and it's very tricky when it comes to the elderly. Diet is the word that we use when we talk about a eating pattern. We're going to talk about some diets. If you have questions about diets, please zing them out, throw them. We'll discuss them. I don't like using the word diet. I like to just say eating better. Because as soon as you say, okay, hey, I'm going to put you on a diet, immediately, what do you all do? You give me the bird, you turn off, you don't pay attention anymore, right? If someone said, hey, you need to go on this special diet. I'm an American. You can't tell me what to do. And as soon as you say that word, the D word, people shut off and they don't pay attention anymore. Okay. So we're going to be talking about, there are a couple diets that are, from a scientific standpoint, they have a lot of research behind them, that they are helpful and they are beneficial. And we'll talk about those as we kind of go on here. But for the most part, I don't like going into diet. I don't like saying the word diet. Ultimately, aside from 2 of them, all of them don't really do a whole bunch of crap for you anyway. And 9 times out of 10, most people end up going back to how they ate before they started that special diet. But we could talk about that as we kind of go on here. All right. To eat well, you need to learn about the nutritional value of foods, which we will look at as we go on throughout the semester here. The effects of diet on health, that's what really this entire class is built upon, helping to prevent some of these chronic diseases, high blood pressure, type 2 diabetes, atherosclerosis, all these nasty, nasty, nasty things that you can get. And then changing your food behaviors. And that's the hardest one. Okay. Eating a certain way for a very long period of time, it is not an easy thing to change. I used to practice before I started teaching full time. And I had this patient and he had a heart attack and he's like, survived it. And he's like, what can I do? Sat down with him. I'm like, this is what you got to do. A couple years later, I see him again. And he had another heart attack. He obviously didn't listen. He didn't do anything that I said. And then he ended up having a third one. Like, what the hell? And then his wife started pleading with me to talk to him. I'm like, he's not going to listen. Unless you're ready to change these behaviors, there is nothing that anybody else can tell you to do or get you to do or try to do for you. You have to do it for yourself. Okay? And changing these behaviors, these patterns that you have, is the hardest thing. But if you want to be around, you got to change those behaviors. Okay. And it's really difficult. Really difficult. I get it. Okay. I get it more than you will know. Most Americans, they really, I mean, I'll have some studies posted up a little bit later in the semester where we look at Americans don't eat fruits and vegetables. I think I have one study later on the semester where it looks at children. They don't even get a serving of fruit. And I think 1 in 10 or 1 in 8 or something like that gets a serving of vegetables. Now, once you throw tomato sauce into it, ketchup, then I think it goes up to 4 out of 10 children get a serving of vegetable. But come on, man. Ketchup. Fruits, vegetables, whole grains. These are kind of the three type of foods that are foods of concern here, especially here in America, because those are things that we generally don't get enough of. What we do get enough of, we love the meat. Okay, we love red meat. Can't get enough of it. We love cheese, we love sugar, we love refined grains, we love sodium. Those are all things that in excess lead to a lot of the chronic health conditions that we're trying to prevent. Poor dietary practice leads to obesity. Obesity leads to, or usually goes along with, type 2 diabetes. Cardiovascular issues. Heart has to work harder. You have excess weight on you now. Heart has to work harder. Lungs have to work harder. Have to carry around all that excess weight. Now you have more aches and pains. You don't want to get out and move around as much. And so you sit even more. And this can lead to, and metabolic syndrome is kind of a catch-all, if you will. It looks at, there are multiple different things that go associated with it. It is a collection of various different conditions, generally obesity, type 2 diabetes, and high blood pressure. Okay, that's what you're going to see with metabolic syndrome. All right. So improving your diet is just one little aspect to help to prevent a lot of these nasty things in here. Okay. And type 2 diabetes is different from type 1 diabetes. Okay. Type 1, you're born that way. Okay. Type 2 is generally acquired through poor dietary choices, healthy lifestyle choices.